Hello, I'm Fara Sax, and this is the Community Voice, and I'm stepping from my marketing and advertising consulting position here at Community Newspapers into the studio sharing medical information important to you and the community. This is a really wonderful opportunity because I have my guests is the son, his son, Alex, is producing this show today. So I have father and son in the studio today. For me, it's quite a moment. So thank you for sharing your son, Alex. Big shout out to Alex for helping us, making you look spectacular as always. Vascular surgeon Dr. Tsoukas from the Miami Vascular Specialists is with me. He is going to talk today about the Vein Center, which is focusing on cosmetic sclerotherapy. We're talking about veins today, aren't we?
That's right. That's all about veins. And thank you, Farah, for inviting me again. It's so much fun to be back at Community Newspapers.
You were with us. I was looking at the old.
It was about 9 months ago.
It was.
Right?
It was 9 months ago you were with us when you were first starting the Vein Center. And you're part of a bigger picture where you do all kinds of life-saving Superman heroics for people that are suffering that need vascular surgeons.
Well, we don't need to overplay that. I mean, we're just doing our jobs, and my partners are still, entangled in this type of work. The life-saving and limb-saving role of vascular surgery. We're just doing our jobs, but it's a very challenging type of work. I'll just tell you that I have transitioned very happily, at least for me, from that type of work into the less demanding, more fun, I should say, venous work. It has less of this life-saving or limb-saving role. It's still very important, as we will see. I brought some slides for you today about the prevalence and the incidence. It's a very common problem and vexes a lot of people. But it's not as acute and as threatening as the other problems that I used to deal with and my partners still do, all the limb-saving and life-saving procedures.
So at the center now, which has been open 9 months. I mean,
right.
That is amazing. So tell me a little bit about what you treat there and that journey, how it's been in the last 9 months since we were together on the Community Voice.
Okay, so, the last we spoke about, we were just starting. We were building our waiting room and so forth. I'll show it to you, one of our slides. But needless to say, in the words, when I think about the center, I go back to what, I don't know if you're following tennis, Novak Djokovic said about where energy is. He said very pointedly, energy flows where attention goes, right? And we decided to pay attention to venous work. This is why a group that has been doing venous work for over, I want to say 40 years, we decided to actually compartmentalize it and make it into a vein center. Because attention goes into the venous work at this point, and it actually has paid off in many ways. Our volume has gone up. We have been doing at least 10 cases a week, and the equipment has improved substantially. We have standardized the way we do it. There is a dedicated vascular lab, dedicated staff. We have a dedicated line, phone number, a cell phone that patients can text 24/7. So it has improved significantly, and I actually see that in the feedback from our patients.
Is this because we're living in Miami that it's so prevalent? Because we show more skin usually, and people are more into what they look like. Who is that patient? Why would they come to you? Are they having problems? Is it a circulatory problem? Once you wean that out, I guess you use some ultrasound to say that it's not really life-threatening, and it's just a cosmetic situation. Like, who comes to you?
Correct. So we have patients from all walks of life, right? We have the young patients who are more cosmetically inclined. We have the older patients who are standing a lot. I've had nurses from our hospital who stand for 18 hours a day, and they have a lot of varicose veins. The veins actually cause a variety of symptoms, such as aches, pains, cramps, congestion, discomfort, itching. That gets sort of vexing towards the end of the day. We've been standing all day, and the gravity sort of acts on the venous system and dilates the veins and increases the pressure in the lower leg. And the patients tend to feel it more towards the afternoon or towards the end of their shift. So we have the type of worker who needs comfort. We have the patient who's cosmetically inclined. And I can't say that it's limited to male or female. We have male patients as well.
And is this a hereditary situation?
Yes. So there's no question that we all have it in the family. When we have varicose veins, and having said that, if you had to pick one problem, right, that you had to have, varicose veins wouldn't be a bad problem.
Right.
I would pick varicose veins any day over any other vascular problem. But yes, it tends to exist in the family. We have a family member with varicose veins, and it has to do with the function of the valves. If you think about it, the blood has to circulate. It needs to go down to the leg and back up to the heart, right? And the veins work against gravity. There's no pump on the other end, nothing to push the blood. So we use our muscles to push the blood up. And when gravity wants to pull it down, the veins have valves inside them that close and prevent the blood from coming south. Some of these valves don't work perfectly. And we are born with these sort of, I wouldn't say defective, but the valves are not closing completely. And over time, they dilate, and the vein gets bigger and bigger. And I see it as a tree and its branches. The valve is the root of that tree. The vein that's connected to that valve is the trunk, and the branch is everything we see on our skin. So we end up seeing the branches of a tree that's rooted a little bit more deeply in the leg.
So I know you brought a couple of slides. Maybe we should just go through that to see who would be the candidate and how we would move forward and why we would come to you once we know that it's not a life, God forbid, problem that it's going to affect us, and but just know that it's maybe cosmetic or we're just irritated by this problem.
Sure, yeah. I mean, doctors, we always have slides to show. So
I'm gonna indulge you. I'm gonna indulge you just this interview, though.
Okay, very briefly.
Okay.
Let's show some slides. So that's our waiting room. We have all become designers, so to speak. All the doctors have contributed a little bit. We try to make it relaxing and spa-like.
And where are you
For the
located?
veins work. We are in the campus of Baptist Hospital in the very west side, in the
So you're on Kendall. So you're on Kendall Drive.
On Kendall Drive, and in the very west end of the Baptist campus.
So this is one of the waiting rooms?
This is our dedicated vein waiting room, and the phone number on the bottom is if you have interested patients in the audience. That's pretty much the most important part of this presentation, to save this number. You can call it 24/7, and you can actually, it's a cell phone, so you can text. I would recommend texting because our dedicated nurse will actually get back to you within 24 hours.
So it's 786-776-7866.
That's correct. That's correct. The next slide. So, as I was saying, it's not a life-threatening or limb-threatening problem, but it's a very common problem. 1 in 5 adults will have this problem. And if we take the spider veins, you see those little veins in the picture, the tiny
I don't have to look at them because I have my own. I know.
If I look, I probably have some too. And so 80% of adults will have some of these spider veins. Let's go to the next slide. So, and it's not just spider veins, right? You see the broad spectrum of pathology, from the spiders to the down on the left, you see the little bigger reticular veins, and to the right, what we call, sort of in a joking way, we call them the anaconda kind of veins, the very large, varicose veins that some of the mostly male patients come in with. Next slide. So I enlarged that drawing that we had on the top left because this is pretty much the schematic where we can understand a little bit about this pathology. And the tube that you see in the center of the picture is the greatest saphenous vein. That's pretty much the mid station for the venous system of the leg. You see how rich that collateral tree is, how many communications there are. What we actually see on the skin is on the top of that slide, the top of the picture, what we call telangiectasias, but the root of the problem is usually a little bit deeper in the saphenous vein. Sometimes we have to treat the saphenous vein first. So let's go to the next slide. And when we do that, in the old days, we used to do surgery. these days we have this catheter. You see now some pictures where the catheter is actually being inserted. The sheath that aids the catheter is about to go in. Let's go to the next slide. We use ultrasound for this. And, this is a complex slide, but and medical meetings are more appropriate for this. But what I wanted to show you, I'm showing the skin scar with my finger at the end of the procedure. That's pretty much all there is left for the patient to worry about after we're done with it.
And does this last, what's the longevity of it, being gone or not being visible?
This procedure is successful 95% of the time within 5 years. There are patients who recanalize the vein, who the veins come back. And these are usually the bigger patients that have a lot of pressure higher up. One of my patients said it very well, Doc. He said, it's like water down the mountain. You stop it here, we'll find another way. So when you have, the bigger patient has a lot of pressure higher up, the venous system will find another way to bring the insufficiency of the reflux down.
And it's not very painful. These procedures?
Procedure, no. I initially, 15 years ago when we started doing it, I was prescribing pain medications for a day or two. I stopped because patients weren't taking them. So we don't prescribe pain medications anymore. Patients walk right away.
And is it downtime?
I don't let them drive for a day. I don't know why.
It just sounded good, right?
But
give them
yes,
excuse not to go to work.
I let them drive the next day, and we usually do them on Friday so people can go back to work on Monday. So the technology has simplified the downtime by miles.
Wonderful.
It's very different. So let's go to the next slide. So because this is what I wanted to talk to you about today, about foam sclerotherapy has become sort of my new hobby, if you will. This is a schematic where it shows you how we make foam. We use a very old sclerotherapy medicine. It's been used for over 50 years called sodium polydocanol. We mix it with CO2 and we agitate it through a three-way stopper. You see it there on the right, between two syringes, and that makes foam. Well, the foam spreads and propagates throughout the tree of this, and I'll show you some very interesting videos of how this actually happens. And it's spectacular, when we get it right, so to speak. We do the injection of the foam very close to the base. We see the entire tree, this complex formation just kind of disappearing. You'll see how it happens on the videos. Let's go to the next slide. So foam, actually you see the reticular vein as it being injected from left to right. I don't know if it projects well, but you see the vein disappearing. One more slide. Same here. And finally, the phlebectomy is again an office procedure we do under local anesthesia. Now this becomes a little bit more, more bloody. We may lose 5 or 10 cc's of blood, very little. But it's something that's, basically you have a vein exposed. It's interesting for me to see. I didn't know how patients would tolerate, but I see patients actually watching this as I'm doing it and giving me tips and advice. It becomes very interesting, as we do this with the patient awake, looking at the vein coming out and saying, Doc, come on, take a little bit more out.
It's community medicine at its best, right?
So I think are we done with this? Is this the last slide?
How many physicians are working in the vein center?
So we have 4 physicians doing procedures. I am the main physician doing the procedures there, but it's very hard to take that interest away from my partners, so they get involved with some of their patients. So we have 4 in total.
That's great. And it is. Can they get an appointment the same day? Do they have to wait? Is there any kind of medical clearance that one has to do before they come see you?
So if they call the number and there is some type of urgency, for example, sometimes we have bleeding viruses, we can see them within 48 hours. Most patients will get an appointment within a week or 2. And there isn't really any significant clearance other than insurance authorization. We try to use the insurance as much as we can. We know that most of this work, foam sclerotherapy specifically and especially, is mostly cosmetic. But some of these patients have deeper pathology that we can use, and we try to involve the insurance as much as we can.
Well, that's wonderful. We're going to go look at the actual procedures now, and I'm just going to make a little bit of a note that if one is squirmish, just for the next 5 I'd say 2 minutes. We're going to just show some stuff that might be a little sensitive, and hopefully I won't pass out over here on the mic, okay?
Fair enough.
Okay, so Alex has a couple.
The first two, this is a sclerotherapy. So we're injecting the base, and see how, I mean, this is a lot of fun for me and my staff to watch. You see how all of these little spiders are disappearing, and with the gauze, you're actually pushing the medicine a little bit further. Let's look at the next one. Same thing here, complex varicosity, complex spider. And if you inject the base, it actually, there it is, they're gone. Patients enjoy this too. They just see their veins disappear, and
I don't know. I'm holding my breath.
They keep cheering, Doc, do that one, do another one. It's we're having, it's a big change for me from the ruptured aneurysm to this, right? I can sleep better at night, I'll tell you that.
But what you've seen before as a vascular surgeon has been so unbelievable compared to this. This must just be so much better. Like you said, you sleep better at night.
It was very intense, right? After you do a ruptured aneurysm, and you always second guess yourself, what could I have done different? Could I have done this? Could I have done that? It just takes you days to sleep well at night. This is entirely different. We are cheering all the way, so to speak,
Absolutely.
doing these injections.
And the patients, what is some of their feedback?
Some of the patients are extremely happy. They come in, they want the other leg done and so forth. So I appreciate marketing very much, and it's very important, but most of my patients are actually word of mouth. Patients seem to bring their family members, their friends, relatives, and so forth. So we have created sort of a clientele, based on that.
So when one goes into the office and is treated, is there a wait time in the office after the procedure has been completed?
So we like them to stay for about 15, 20 minutes.
Mm-hmm.
The leg is bandaged for a little bit of pressure to contain the medication and the veins to reduce sort of the venous volume. And we like them to walk for about 5-10 minutes to be sure they're asymptomatic. We haven't had any problems.
That's wonderful. And you're close, and you're a Baptist. What better place? And you're all doctors, so you're in a really good place.
You would think so, right?
Oh, my money's on you. We have one more that we're going to look at.
This
procedure.
So this is the more involved, so to speak, the venous procedure. I'd like to tell you that the patient was actually watching this.
Oh, I don't know. I'm looking away sufficiently.
And she was actually giving me instructions on how to take this vein and so forth.
Instructions?
But this is something that we do under local anesthesia, a very tiny incision.
Wow. What other procedures do you do at the vein center?
So this is just the small end of the spectrum, is what we call the superficial.
So we're talking about spider veins?
Venous insufficiency, spider veins and reticular veins that we do on a sort of an outpatient basis. We have other types of patients. There is a classification called the CAP classification. So my patients are probably the C1s, 2s, and possibly 3s. There are the 4s and the 5s, patients who have significant problems, ulcers that won't go away. They have to come back every 6 months to a year with another ulcer and so forth. One of my partners, for example, Dr. Taubman, has a research project that's working on an artificial valve that will improve the lives of these patients. This is done in the operating room. Is more intense and more demanding in terms of skill and so forth. And it's also being done. So the fact that I like to present the cosmetic part and the sort of a more fun superficial venous insufficiency doesn't mean that we limit ourselves in that. Some of my partners still do the heavier, pretty much the whole spectrum of the disease.
So what are some of the complications that might happen with this cosmetic sclerotherapy?
So there is no, and I ask, my patients tell me, Doc, this is going to be a cheap shot, right? This is a nothing. There's no nothing in medicine. And everyone needs to understand and know this. There are occasionally, if you do millions of procedures, there will be an occasional patient who will have an allergic reaction and something catastrophic will happen. So you cannot be careful enough, number one, with allergies. We like to do a little test injection to see how patients will do it, because I'd say that every 100,000 or so, somebody will be allergic to polydolcamol when we have a problem. So allergic reactions can be a problem. In terms of the cosmetic part, some of the injections will stain, and the stains will be like a brown line where the vein used to be. Those can be pesky. They can stay around for 2 or 3 months, but they almost always disappear, 90% or more.
Do they just go voila and they're gone, the veins, or they just, the body absorbs them? What happens to those veins?
So some of them do exactly what you said. Patients come back and the veins are gone. Some actually have what we call an inflammatory reaction. So there is some red and irritation for 2.5 weeks. So I always warn the patients they may look worse before they look better, but the body does absorb them. Keep in mind that the veins are not like the arteries. Arteries are very precious. You lose an artery, you have a problem. Most of the veins, especially the superficial veins that we treat, are sort of redundant, right? They are like a weed. That if you pull a weed, you're going to have another weed perhaps in a week, or it's gone, but it doesn't really bother you. So you don't need those superficial veins for your venous circulation. So we have the luxury of being able to remove some of these veins without affecting the function of the venous system.
So by doing this cosmetic procedure, does it eliminate those that are suffering from that throbby leg feeling? And how does that work? How does that mechanism work in the body? By treating them, how does that eliminate the pain?
So again, the leg is a very complex structure, right? Pains in a leg could be because of arthritis, it could be muscle cramps, it could be the nerves that come out of the back. We call it spinal stenosis or sciatica. Most of us are very familiar with that.
Oh, yes.
And it can be also vein pain. And it's sometimes it's hard to pinpoint. In fact, you have to eliminate the vein, you have to do the vein procedure and eliminate the vein pathology to absolutely know that the throbbing, the pain, the congestion, the discomfort was because of the veins. And that's another warning I give to patients, that throbbing, congestion, swelling, itching is usually venous. Pain, the sharp type of pain, may be a number of other things, and I can't always promise that the pain will go away.
It's so interesting. We're such a science experiment. Our bodies are such a chemistry set. Sometimes you don't know where the mechanism of pain is coming from.
Very complex. We're very complex beings. And I will tell you that...
Just ask my husband, he'll tell you.
And I will tell you that some of the chronic pains are actually, they have to do with cerebral issues. So
you uncover something else for a patient sometimes, and you go, whoops, I didn't know that, but maybe you saved a patient's life.
Perhaps. I don't know about saving their lives.
I
wish I could say that maybe 2 years ago when I treated a ruptured aneurysm that the patient would bleed to death, right? But I would say that improving their quality of life, that's for sure.
Absolutely. So what is the future direction? What are we going to do in 9 months when you come back for another interview with me? Where do you see the direction of the Vein Center?
So at this point, we have pretty much standardized our existence. We have a dedicated vascular lab. We achieved the very coveted IAC certification.
What is that?
Intersocietal Accreditation Committee came to us. They put you under the looking glass, so to speak, and they find all kinds of things that could be wrong, and we passed. This is actually we passed for the second time, and we're very proud of that.
Good for you and good for the practice.
And we are hoping to build a little bit more volume. The other thing, I'd like to look at more modern technology such as the laser. The last time we looked at the laser for spire veins, it wasn't quite there yet. The success was about 50%, but I know the technology is evolving like any technology. And I'm very excited to look at that at some point in the future.
So that would not incur a shot or anything that punctures the skin.
Correct. This would be completely percutaneous. And again, the last time we looked at it, it wasn't quite there in terms of success rate. The sclerotherapy, the injection is a lot more successful at this time. But I know that the technology is working itself to do something completely percutaneous.
Well, I'm glad you're able to sleep at night. That's the most important. And it's such a
Me
different.
too, Farah.
It's
It's
so
changed my
different.
life.
We as patients, we don't realize that doctors have feelings too. That you carry a lot of what happens during your day home with you. And if it was a life and death situation, let's just say, we negate that part of the equation.
And we don't realize, even the physicians don't realize it until we actually have changed our lifestyle a little bit. And we understand it, we know it from what our family members and other people are telling us, such as, you're so much more relaxed. You have become a different person. That sort of thing.
So what was your aha moment for you to realize that you need to step back and pivot in the same industry, but just something a little bit more gentle to your soul?
Well, some of the age changes that happened to us.
Oh, no, come on. We're 20 and Holden.
Well, I wish I could, wholeheartedly say that, but I'm not the same person I was 10 years ago. And my endurance, so to speak, is not, what it was. So waking up at 2 a.m. and working the next day, a full day with demanding procedures, it started being taxing to me. And it just demanded that type of change.
Absolutely. Absolutely. So when one comes to the vein center, you'd accept insurance.
We do. Most insurances, actually.
Good. And the time that we have left, what would you like to share with our audience that we might not have covered during our time together today?
Well, that the fact that our group does very diverse type of work, and I couldn't speak enough for Miami Vascular Specialists, right? We have a multidisciplinary group that consists of intervention radiologists, neuroradiologists, vascular surgeons, and diagnostic radiologists.
And it's a big practice.
And it's a practice of, I want to say, and the number changes, right? It's in flex. But we probably have about 50 physicians. There is really no interest to promote one treatment versus the other. When a patient steps in to be seen, they're seen by 2 or 3 different services. There are several pairs of eyes looking at the films and the pathology and the history. And
for those services, it's not just Baptist Main Hospital, it's throughout the South Florida area.
Correct. And we cover mostly the Baptist system, but like you said, the hospitals spread within entire South Florida area location. So we go to West Kendall Hospital, Homestead, Doctors, South Miami, and so forth. And we like to think that we are multidisciplinary and we are holistic in the sense that we look at the patient from many different sides. And there isn't really an interest to do surgery versus stent or angioplasty. We try to pick the best. There's no one size fits all. We try to customize and pick the best treatment for the specific patient. I mean, that's been our motto pretty much. And I have been very proud of that. I'm sort of out of that scene a little bit, but all my partners are still very well into that.
But it's so nice to have been able to recreate yourself a little less than a year into the vein center and to really help people with really specific problems, making them feel better for a better quality of life, feeling good on their feet kind of thing, a little pep in their step, maybe wearing a little sundress a little bit higher, a pair of shorts that make them feel comfortable and not having pain. And I think that's the gift of what you do, and we appreciate that as a community.
And I appreciate your time. And again, let me just reiterate, it's always fun to be here with Miami Community Newspapers, and a great pleasure for me to do this. I'm so proud of my Alex as well.
Oh, we could talk a whole show just about Alex, and I really appreciate, Dr. Tsoukas, that you were coming today. And for more information, it's miamivascular.com, 786-776-7866.
That's correct.
Thank you for your time today. I'm Fara Sax, and this has been The Community Voice. And take care of yourselves and each other. Have a great day.
Thank you, Farah.
Thank you so much.